Have considerations of potential legal challenges figured into your positions on campaign finance legislation in the past?
Help me understand where you're going, Peter.
Have you not supported certain pieces of campaign finance legislation because you thought that they would be subject to a constitutional challenge that would end up costing Vermont a lot of money?
No, I actually was one of the people that worked together with Governor Dean to push through the campaign finance law that we wish had prevailed in the United States Supreme Court. And I thought we should test Buckley-Vallejo for the simple reason that any Supreme Court, in my judgment, that equates corporate money with free speech is on the wrong track. So I thought Buckley-Vallejo needed a challenge. I'm glad that we challenged them. Sorry that we didn't win that one. But if you look at Washington today and why it's so dysfunctional, I think one of the main reasons is that corporations have more and more influence over our democracy, and average citizens have less and less influence over our democracy, which is why you can have a whole budget deal held up on the fact that average voters are going to take it in the teeth when vulnerable Americans have their Social Security cut or their Medicaid or Medicare benefits cut. But the idea that we would ask millionaires and billionaires to join up is suddenly out of the question. So we did the right thing in challenging Buckley-Vallejo. It's too bad we lost. America would be in better shape if we prevailed, and our democracy would be in better shape. I don't think there's a more important issue, frankly, in the long run than getting that decision, both Buckley-Vallejo and citizens, reversed.
Governor, I have a question in a different direction. And that is, I've been looking at Wendy Logan's figures. She's done her own analysis of a potential health care plan based on comments that we made last February about the benefit level being at a catamount level and using payroll tax to cover the cost. And I wonder if you could comment on what she's developed. She says that we've run several $100 million a year in debt year over year if we went ahead with a plan based on those two ideas.
You know, all I can say is this. Obviously, I haven't analyzed her numbers, but anyone who can take where we are right now and turn it into a way to pay for it, I believe is on a path that isn't going to lead to a productive outcome for this simple reason. As I've said many times, our challenge in Vermont is that our healthcare spending has doubled over the past decade. We've gone from $2.5 to $5 billion. By 2015, we're going to be asking Vermonters to spend another $2,500 every single year out of their pockets for healthcare in a state where they're making the same money they were making a decade ago. And I asked a simple question, where's that money supposed to come from? So the board that I'm about to appoint, as soon as I can, is going to be charged with the challenge of designing the first healthcare cost containment system in America that works, that spends less money for better outcomes. Now that's a big challenge. That's the hard part. Moving to a system where you can adjudicate your bill when you come out of the provider's office, where you can use that same card, the Green Mountain Healthcare card, as a pipeline to your medical records so that we can stop duplicating services and manage care better and moving from a fee-for-service system to one where we reimburse our providers for healthy outcomes. This is really hard work. Now, I'm convinced if we can do that, there isn't a business in the state of Vermont, there isn't a citizen in the state of Vermont who won't say, we can figure out how to pay for this, because we're going to be paying less for better healthcare outcomes. We're going to be creating jobs and economic opportunities. We're going to divorce healthcare from the employer's burden. It will be shared by all of us, and we'll be more competitive than the other 49 states. So that's the hard part. Anyone who's trying to figure out how to pay for that now is, I think, on a wild goose chase, because we're not going to do it unless it's going to cost less. How much less, and what are we paying for? I, in my business, have never been able to figure out how to pay for something if I don't know how much it's going to cost. So our challenge is to figure out how it's going to cost less. That's the hard part. I'm convinced we can do it. When we do, we win.
How do you do it? I mean, docs aren't too excited about it, for example.
Well, you know,
win people over who are in the business who are making money now. How do how do you say, okay,
Well,
give up your share?
we're not asking them to give up. We're not asking them to give up anything. And if you talk to most healthcare providers in Vermont, they will tell you that the current system is not sustainable. And we all kind of take that and go, oh, wow. You know, that's sort of a big one. We're not talking about a car wash going out of business. We're not talking about the corner grocery store. We're talking about a healthcare system not being sustainable. It's not sustainable for a number of reasons. One of which is Vermonters don't have another $2,500 to pay out of their pockets by 2015, every single one of us, to pay for the system we have. The second is that Medicaid, Medicare, and government programs don't reimburse at an adequate level to allow our providers to stay in business in a small rural state and some of our small hospitals. So, you know, can't blame people for being skeptical. We don't know what the plan is. They don't know what the plan is. So, of course, they're skeptical. But I don't hear too many healthcare providers going, wow, we've got a perfect system. Please leave it alone. And where I think we're on the right track and where I think we'll win over converts as we move forward with a plan that they can actually examine and help us develop is a simple fact that we need a sustainable healthcare system. We need an affordable healthcare system. We need to create jobs and economic opportunities. And while the other governors don't deal with this one, I'm willing to, and I say if we get it right, we win.
Have you talked with anyone either inside or outside the administration about who you think the chair of that board might be?
Well, I'm going to be looking at all the candidates that will be sent to me shortly and making the decisions on both the chair and the individual members all in one block.
Have you had any discussions to date, though, with people about who you think the chair will be?
I don't know who all the candidates are yet, in fairness, and that's the way the system was set up. So until they choose who, it's like judicial nominating. Until they send me names, I can't really do that.
But have you had any discussions with people about who you think the chair might be?
Well, I've got some ideas.
When you say less, do you mean less or slowing the rate of growth that we've been seeing over the past decade and now it's projected out? I mean, I'm trying to say when you say a cost containment system that works, it's where people, you know, are paying less and for better
Right.
outcomes. What do you mean by that?
What I mean is that the current double-digit increases in healthcare spending, the 20 and 30% increases in insurance premiums, where we're all, you know, buying more and more insurance, I should say less and less insurance for more and more money, that it's not sustainable. If we could get to the point where we're just spending what we are right now, $5 billion instead of $7 by 2015, that's not realistic, by the way, but that would be fantastic. But, you know, all I'm saying is I understand how big this challenge is. I understand why people are skeptical. I understand that government has failed on this one almost every single time because they haven't gotten cost containment right. But I think there's a huge opportunity for us here to do what the rest of the world is doing, the people that we're competing with for jobs and economic opportunities, by getting better health care outcomes for less money. And the reason I'm so optimistic about it, Shay, is the waste is mind-boggling. You would never design a healthcare system like the one we have in America or Vermont. The providers are unhappy. They got insurance companies second-guessing them. They can't serve their clients half the time because they're only getting paid 40 cents on the dollar, so they got to turn them away. You got 150,000 Vermonters who pay for insurance, but it's not enough to give them the security that they actually have insurance. That's a huge number out of 625,000 people. You got another 42,000 who have no insurance at all. I mean, this is not a good situation, folks. And all I'm saying is, with what's going on in Washington, this is one thing we know for sure. Real reform isn't coming from Washington. What's going on with many of the other governors across the country, they're focusing on collective bargaining and God knows what else. Real reform is going to come from there. It's going to come from 3 or 4 or 5 states, as the president has said. And let's let Vermont be the one. We all win on this. So is there a lot to be nervous about? You bet. Is this ambitious? Sure is. Could we get it wrong? Absolutely. If so, we won't go forward. But let's give this board, the smartest board we can, put them to work to do what everyone that we're competing with jobs and the rest of the world is doing. Better health care outcomes for less money. And I say that there isn't a bigger economic driver out there. Now let me just point out this. This debate they're having about in Congress about debt ceiling and cutting spending, listen, you could cut all of the things that the Republicans want to cut and you still wouldn't balance the budget. Because health care spending on a federal level is out of control. just as it is in Vermont. And you will be right back where you were in 4 years with current health care cost increases, Medicaid and Medicare, from the federal government, if you made all the draconian cuts they want to make. So if Vermont is the first to get this right, we grow jobs, we grow economic opportunities. I think the rest of the country will follow us. And, you know, I know it's tough, but you elected me to get tough things done.
I have a question about the data. I've been trying to get, hold of some, and it's really not that easy. And it just makes me question whether or not the state has access to the kind of information it needs to track the waste that you were talking about.
Not yet.
And if you don't have that information, how can you possibly make decisions about cap and spending?
Good point.
So what's your plan for moving forward?
Our plan is to use the federal dollars that we're going to garner from the federal government because of Obama's health care bill, which I think is a great step forward, and use that to invest in the technology and the systems that we need to be able to deliver on the promise that I just outlined. Listen, the question you ought to be asking me is, Governor, no one in America yet has a system where you can adjudicate your bill when you come out of the provider's office. That's 8 or 9 cents on a dollar. How are you going to do that? No one yet has a universal system where that same card can be a pipeline to all of your medical records, and every provider can see what you did with technology. This is the hard part, not Wendy Wilton's math.
Well, I just have a question about that too. I mean, if you've got a 2-year gap, 2-year window between
An election between now and when most governors would be able to roll a plan like this out. John Lynch and I share the 2-year term. Others would have 4 years to put this together. I'm not advocating for a 4-year term, don't get me wrong. But we can get this done. And I understand there's not a lot of answers yet. That's why we need this board designing this really hard system. All I'm saying is that the hard part isn't how to pay for it. We're paying for it now. We're paying too much. If you said to any business in Vermont, hey, we just came up with a cost containment plan, and we can assure you that your rates will only go up 2%, 3% a year for the next 5 years, and you'll have universal coverage. I don't know, as one business person, I'd say, where can I sign up? That's not the system I have now. Now I got a system where every year I dread the thing I can't control. That bill from Blue Cross, Cigna, or MVP that says you're up 20%, you're up 26%, you're up 32%, you're up 15%. You know, paying for it is the easy part.
Yeah, she has questions about the savings, actually.
Well, I don't blame her. So do I. That's why we need the board to design the system.
I actually had to cut this off.
Just one last thing, shifting gears a little bit. Do you agree with Senator Sanders that it would be good if President Obama had a primary challenge from his left?
No.
Right? Do you think President Obama's been far enough to the left to suit your taste?
Yes.
What do you think of Bernie saying that?
You
Does
know,
it make him persona non grata with Democrats?
you'll have to ask Senator Sanders that. All I can say is, you know, President Obama got handed a heap of problems. I understand the feeling. And he's done a great job taking those problems that he didn't create and turning them around. He's the smartest person I've ever met. He cares about this country deeply. We're never going to do any better. Let's get him reelected.
How about, as a UVM trustee, your thoughts on outgoing President Fogel's compensation package for 17, 18 months? He's going to get paid his presidential salary with benefits, et cetera. It's going to be over $400,000, maybe $500,000. And then